Hi, I'm Dr. Nathan Wong. I am the dentist and owner-operator of Floss Dentistry here in Edmonton, Alberta. I opened this practice because I wanted to provide my community and patients with something different, a different patient experience, different technology, and show them that dentistry isn't what it used to be from years before. As an operator using Aevo, it actually affords me, number one, safety for my patients, and number two, decreased patient and then subsequent chair time. So by safety, what I mean by that is we know that low intensity pulse ultrasound has been clinically proven to target specific cells: osteoblasts, osteoclasts, cementoblasts. And specifically, I know in ortho, one of the things that we don't like to talk about, but unfortunately can happen, is orthodontically induced root resorption. And so with the Aevo, I'm able to utilize this low intensity pulse ultrasound, target those cells such as cementoblasts, and now I'm having decreased root resorption, and that safety is really paramount for me. So for me, I like the safety factor. The second reason I like Aevo, and the reason why I integrated it into the practice, is decreased patient time, which leads to decreased chair time for that patient. Let's be honest, patients don't necessarily want to come to the dental office super frequently. Especially with COVID, patients didn't want to come in at all. And so during that time period, we had to shift and kind of make a paradigm shift of thinking, how can we treat these same patients over an extended period of time, but make sure they're still tracking? Well, Aevo is one of those ways. And so essentially for me, it has halved patients' treatment duration or time, and that means they have less patient visits. For me as an operator, our dental team now has increased chair time for more productivity. My patients report two things. Number one, decreased discomfort. And the second thing they recognize is that when they graduate to their retainers on that last day, they actually come to realization that they would have only been half done potentially that treatment. So in my experience, my patients are done in about half the time they normally would be with just regular band and bracket or Invisalign treatment. So I'm finding that having that time has been immensely awesome for patients. Yeah. They don't have to come in. They are happy that they're done in half that amount of time. And with regards to the discomfort, prior to using Aevo, I was finding that patients were noticing discomfort for anywhere from about 3 to 5 days. So they do an aligner change, and they notice, hey, my teeth are really sore, doc. It was hard to eat. It's been like that for each aligner change. Is it going to be like that from here on in? And literally, it would be like that. But I'm finding with the Aevo, patients, number one, aren't actually reporting it as a concern, the discomfort. And when I ask them, when I actually prompt them to talk about it, they're like, yeah, actually it was maybe sore for a day, maybe two, but it wasn't bad at all, and then it was gone. Excellent patient experience. I think for the reasons we talked about, decreased patient time, decreased chair time, integrating a patient experience that is faster and more efficient, decreasing the discomfort, and all these things to me make it a no-brainer. You know, if you can tell me as a patient that I don't have to come in as frequent, you can tell me that I can be done in potentially half the time, and this is really easy and straightforward to use, sign me up. As an operator, as a clinician, if you could tell me that, in my experience, I found that my patients are having their treatment time and they're not complaining about discomfort anymore. And I'm really relaxed knowing that orthodontic root resorption, that is being decreased using the ultrasound. That to me is a no-brainer. So if you're thinking of using it, those are the reasons I thought about it, and that's why I'm using it.